will pass it on to Dr. Michael Carvalho. He's a board certified psychopharmacologist, and I will just let him take it away. So go ahead, Dr. Carvalho.
Okay, so this is Navigating the Medication Maze. And my name again is Dr. Michael Carvalho. I'm a Professor Emeritus. That means I have been doing this for a while and I'm now retired. So actually it was interesting when I started talking about drugs in the elderly, I was 28 years old and it was a new kind of refreshing subject for me. Now I'm not only, now that I'm 70, I'm one of the clubs. So I'm talking from experience as well as from the science. So the three sections that we're going to talk about today are basically finding your pathway for either as a patient or as a caregiver, avoiding dead ends, again with the maze analogy, and emerging solvent with some money in your pocket after all the expenses that you've had for your for prescription medications. And after each section, we'll talk a little bit about the we'll pause for questions. So first, we'll talk about finding your pathway. So why is it important to be informed as a elderly patient on their medications? Well, every day, 750 older people are hospitalized due to serious side effects from one or more medications. So that's an amazing statistic. 5 million older Americans sought medical attention for adverse drug effects in 2020. Almost half of older adults take 5 or more prescription medications, and that's not considering what they take as supplements or over-the-counter medications. We'll talk a little about that. There was $62 billion spent in unnecessary hospitalizations due to drug reactions in the elderly. And over the next 10 years, it's estimated that 150,000 premature deaths will occur with elderly patients having adverse drug effects from their medications. And this is what our plan is. 3 spots. This is the first section. Why is it important? Talk about that stat. Next slide. And these are the stats that are important. You see a huge amount of health issues with older Americans, a lot of prescription medications that they take, a lot of unnecessary hospitalizations, and unnecessary premature deaths related to their medication misuse or adverse effects from their medications. Okay, next slide. So what do we need to know to reduce the incidence of adverse drug effects in elderly patients? Next slide. Okay, so I'm always good with, it always helps me to remember when I have a mnemonic on hand. So these are 4 steps that I would tell all elderly patients on medications or caregivers. This is what you need to do to help manage your medications and reduce potential for drug interactions and effects, adverse effects. So D is drug lists. Keep an updated list of all your prescriptions, vitamins, supplements, any of the over-the-counter products that you use, and bring it to every appointment. So this is really important. Now, nowadays, that when you go to a doctor's appointment, they may actually have an electronic chart. They may have a printout of the medications, but it's important that you make sure that the printout that they have is current. So what you might want to do, or tell your patients to do, is get a copy of that from your doctor's office, and when they're, give it to a caregiver to make sure that it's correct, and make the changes that you need to make to it. Then bring that updated, corrected version to the next appointment. So the drug list is really important. And again, not only medications that are on prescription, but also things that you take on a regular basis that are non-prescription. So R is review. Always discuss your medications with your provider. And again, even if you've been on these medications for a long time, Reviewing them is important because the more that you talk about them, the more that you understand what they're used for, what the side effects are, potential interactions. So that's always important to review your medications each visit with your physician or medical provider. You is understand how to take your medications appropriately. Do they need to be taken at bedtime? They can be taken with meals, without meals. These are important, so that how close together can you dose your medication? So all these things are important to understand. So that's important to get that information in that visit with your medical provider. And G, I had a hard time finding what G could be, but I settled on GAB. So GAB with your provider. So talk to your provider. It only takes a few minutes to actually bring this up. What are the barriers to taking your meds? So is there a problem with cost? Is it a problem with access? Are there packaging issues that you need to overcome? How do you use reminders to take your medications? You use pill boxes, etc. And what are the side effects that you can expect? So this is really important that you talk it over with your provider, because a lot of times things like, for instance, cost. Patients sometimes don't want to tell their medical providers that they can't afford their medications, and they're not taking their medicines simply because they can't afford it. Well, there are options, and we'll talk about this a little later. There are options to resources that you can use to help you afford your medications. So it's important that your doctor knows about that. And if there's a generic medication that might be just as appropriate and is cheaper, that might be something that your doctor can help you with. Next slide. Okay, so these are some of the questions that you always have to ask a provider when you're being prescribed a new medication. The patients should also ask about what the purpose of the medication is, what is its use, and how soon can I expect positive results. So if it's a blood pressure medication, is my blood pressure going to go down right away, or do I need to take it for a week or two for it to be effective? So important to know a little bit about the medicine and how it works, how soon it works, so that you're understanding why you're taking it and what your positive outcomes should be. On the other side of the coin, you want to know what the side effects are. So what are the potential side effects? And again, if you look at the side effects, are very much a long list of side effects for all the medications, but there are some side effects that are more common than others. So asking about what the most likely side effects that you can have, and are the things that you can do to minimize them. So if you have an upset stomach with potentially with a medication, can you take it with food? Did that minimize it? If it's causing sedation or drowsiness, can you take it at bedtime versus in the morning? So those are things that you want to know. And some side effects are there in the beginning. Other side effects are there later on as you take the medicine. So it's important to know what the time frame is. And again, any special instructions as to timing of dosing, should I take it certain time of day, with food, without food, at bedtime, etc. And are there any interactions? Are there anything that will interfere with this medication or enhance the effect of the medication on any of the other medications that I'm taking, or over-the-counter medications? How long should I take the medicine? A lot of times we don't ask this question. So for instance, we go for an antibiotic and we forget to ask, do we have to take it for the entire 10 days or 14 days, or just until I feel better? So important to understand how long you take the medication, short-term or long-term, and any special warnings or precautions. So I avoid alcohol when I take this medication is a good example of that question that you should ask. Next slide. So let's stop there for questions. A couple of ones are in the chat box. One says a neurologist has prescribed migraine medication. However, I went to pick it up at the drugstore. The medication was over $700 for a very limited amount. I called the pharmaceutical company, but they were not able to help me in receiving the medication at a discount. We'll actually talk about that at the last section, talk about ways that you can get the medication at lower cost and resources that you can use to help you achieve that. So next question, is it possible to have side effects or reactions to medicines even if I've been taking them for a while? And the answer is yes. Some side effects are cumulative, and it could be that it may not show up for a month or two. So some of them are years later. So just because you have a side effect later on doesn't mean it's not related to the medication. The other thing that happens is sometimes the side effect will be brought on by another medication that you're taking at another time, or an over-the-counter medication. And we'll talk a little bit about that when we talk about common side effects. Any other questions? And you certainly can use the chat function to ask me questions, because I'll be cognizant of the fact that I need to look at that chat box. Okay, let's go to the next slide. Okay, the second section is how to avoid dead ends in navigating the maze. So next slide. Okay, so what I'm going to do is focus on 3 common problems in the elderly and talk about how medications can contribute to this, or being confusing in the equation and trying to figure out what's going on. So let's talk about falls, confusion, and muscle aches and pains. So falls in the elderly are not uncommon, especially when changing position. So getting up out of bed, or after sitting for a length of time, getting up out of a chair. It's not uncommon for that to happen in elderly patients. And there really is a physiological reason that can occur, as well as other situations that can bring up that effect. So falls, a lot of times with changes in position, can occur when your blood pressure drops when you change position, especially if you do it very quickly. And that can lead to lightheadedness and a fall. So very common cause of morbidity in the elderly are injuries related to falls, and very common with changing positions. Another common problem in the elderly is confusion or fuzziness, drowsiness, memory issues. Obviously, that can be related to dementia, early dementia, but also can be related to medications, and we'll talk about that, and understanding how medications can worsen this side effect, or even make you look like you have dementia when you don't. So we'll talk about this specific problem and medication's effects on this. The other one, who doesn't, when they're older, have muscle aches and pains? And we'll talk a little bit about how certain medications, especially a large quantity of medications in a certain category, can actually aggravate this, and what we can do to understand it. Okay, next slide. So let's look at the falls. So again, what happens with falls in many cases, what happens is when we're changing position from a lying down position or a sitting position, what happens is when we're basically standing up from those positions, our blood pressure has to increase a bit to overcome the force of gravity when we change the position. So when our blood pressure goes down, and that's not able to happen, and our blood pressure goes down with changes of position, this is called postural hypotension. Hypotension means low blood pressure, and postural means it's related to a change in posture. So not uncommon for elderly patients to have this, because they're their response to changes in position diminishes over time. So just being elderly makes you more prone to have this potential for postural hypotension. The other issue is that medications can aggravate this underlying disorder in elderly by interrupting the maintenance of blood pressure when we change position. So most blood pressure medications, the purpose of blood pressure medications is to lower your blood pressure. A lot of times it lowers the blood pressure even when you're trying to maintain your blood pressure when you change position. So most blood pressure medications will cause this potentially as a side effect. So if you have this already, taking a blood pressure medication, some more than others, but that can actually increase the risk of falls for elderly patients. Diuretics, which are also blood pressure medications, but they can be taken for another reason, as well as dehydration, which is not an uncommon situation with elderly patients that don't drink enough water and fluids. They can cause a potential for increase in falls. Cardiac medications can interrupt this mechanism to maintain blood pressure when we change positions. So those can cause more issues with falls related to postural hypotension. And some psychiatric medications, some of the antidepressants, some of the antipsychotics, some of the sedative drugs that are used to treat anxiety can also aggravate this potential side effect. So you can see where also, if you have an elderly patient on a number of these different drugs, they may be on a blood pressure medication, a diuretic, cardiac medication, a psychiatric medication. So there have 4 different reasons to have this aggravated potential for falls. So you really have to be careful. So as a caregiver, you want to make sure that you document that this is occurring. It can be readily remedied by having the patient, get up more slowly, dangle their legs on the side of the bed before they get up from a bed position or from a chair, holding on to something before you start walking. So those are common ways that you can minimize this potential side effect. Next slide. Confusion. So again, that can range from just a little bit of forgetfulness to fuzziness to really potentially very confused states. So the medications, again, this can be caused in the elderly patient, but they also can be aggravated by medications. Most of the psychiatric medications that are sedating, anti-anxiety drugs, antidepressant drugs, antipsychotic medications, some more than others can cause confusion. Pain medication, especially the narcotics, can cause confusion because of the sedating side effects. Antihistamines, especially older versions like Benadryl, a lot of the over-the-counter medications can cause a significant sedation, and they can cause confusion even in small doses in patients that are elderly. Some of the over-the-counter antidiarrheals that contain antispasmodics also can cause more confusion. So all of the above really, again, it might not be uncommon for patients to be on a variety of several different drugs in these different categories, and alcohol can always aggravate it as well. And alcohol can be either an alcohol that you've added to the equation by drinking, or it could be alcohol that's part of the medication itself that can be additive to the confusion effect that these drugs and the elderly can have more aggravation. So obviously, if a patient with a little bit of a dementing illness to begin with, this can worsen in combination, or if you have a combination of a variety of these medications, it can also increase the potential for confusion. So next slide. Good example of this. This is my #1 drug to avoid if you're elderly. NyQuil, over the counter. Anyone can pick it up on the drugstore shelf. The label dose is 30 mLs every 6 hours. So what do you have in 30 mLs? You have acetaminophen, 1,000 milligrams. So if you're taking it every 6 hours, you are at the maximum dose. So if you take any of the Tylenol by itself in combination to when you're taking NyQuil at this dose, you're actually giving yourself a potential for an overdose. And Tylenol overdose is pretty serious. You can, anything more than 4 grams per day, 4,000 milligrams per day can cause potential for acute liver failure. So it's not benign. It is benign in therapeutic doses, but not benign in overdoses. Doxylamine is an antihistamine, which is in NyQuil. Again, you have a 12.5 milligrams in 30 mLs, but you're taking it every 6 hours at the dose that's recommended. Very sedating. So it's like Benadryl. Can cause confusion, very sedating. So it's an issue that you need to avoid in older patients. Dextromethorphan is a cough suppressant. It's in Robitussin DM. It can actually cause agitation in a subgroup of patients. Up to 20%, 25% of patients can be slow or poor metabolizers. And they can have this idiosyncratic or unexpected side effect from dextromethorphan of agitation. And that can be an issue. And last but not least, NyQuil has 10% alcohol, and that's because it takes alcohol to dissolve the ingredients in solution. So whenever you take a 30 ml shot of NyQuil, you're taking a 20 proof drink. So you're already giving the alcohol that can combine with the sedation from the antihistamine, not to mention any other medications that you're taking. So this is really an over-the-counter drug that older patients should definitely avoid. It has all the ingredients that might lead to adverse drug reactions. Next slide. So the last consideration in elderly patients is muscle aches and pains, and how can they be part of medications? Well, a lot of elderly patients have cholesterol medications that they're known as statins. And some statins as a side effect can cause muscle aches and pains. And the reason why they do that, some worse than others. The reason why they do that is that these cholesterol medications work by reducing or blocking the production of cholesterol in the liver. They also block, though, the production of a certain enzyme in the liver that's called CoQ10 that is important for muscle strength and muscle metabolism. So because it can do that, it can lower your CoQ10 levels, and you can decrease muscle effects, and can cause issues with muscle side effects that can cause aches and pains, usually in the lower extremities. So this is not an uncommon side effect. Again, some statins are more problematic than others. But a lot of times patients will take their cholesterol medications, and then they'll notice maybe 3 or 4 months after they're taking it, they all of a sudden have more muscle aches and pains than they think of. They have trouble getting out of bed with aches and pains in their lower extremities, and they just chalk it off to arthritis or getting older, et cetera, not realizing that could be related to their statins. Some evidence that taking CoQ10 as a supplement could be helpful, but it's not altogether been proven that that can be a case. That's something that you should need to talk about with your physician or medical provider to get an opinion there. So any questions so far? Okay, so I have a few questions in the chat section. So how do you know when the side effect is severe enough to seek a change in medicines? Is it a length of time? Well, severity is a good example with lisinopril, which is an antihypertensive. Very commonly can cause what's called a dry cough. So what is it severe? It's more of if it's causing an issue, it's causing interruption in your sleep, causing an issue with your throat, that could be a severe enough side effect that you need to change your medications. Other people, it's more of an annoyance. So really, it's individual preference. A severe side effect that's severe enough to cause major problems obviously needs to look at either a reduction in dose or a change in meds. So usually when I was treating patients, it would be whether you change medications or reduce the dose really is the balance between effectiveness of the medication and the side effects. So if you can maintain the effectiveness of the medication at a lower dose, you can lower the dose. If not, you're not getting any effect from the drug, any positive benefit, you're getting severe side effects, that would be an indication to use another medication. Next question is, do you recommend other over-the-counter alternatives to NyQuil? I don't like combination medications because of that. So if you need to take acetaminophen or Tylenol, take it as a single dose. There are other more common, newer antihistamines that can help for sneezing. For instance, something like Zyrtec is less of a problem with cognitive impairment or with side effects with drowsiness. So they're usually don't like to recommend shotgun treatments or remedies in older patients, because the more ingredients that you have, the more potential that you have for interactions and also for problems. Next question is, what if a person has a silent gastroenteric reflex disease, esophageal reflex disease? What are the safest OTC meds to control this problem? Again, if you're looking at that, always talk to your doctor first, because some of the medications that can be used are used to be prescription and is now over the counter. So a drug like Tagamet. Problem with Tagamet in older patients is that it does cause a fair amount of drug interactions. So there are a little bit more safer, newer drugs in that category that can be more helpful. Any other questions? Okay, let's go on to the next section. And how can we save money and still be solvent when we emerge from the medication maze? Okay, so cost of medications can be prohibitive. So for older patients, you really need to look at Medicare does not cover medications, but there are a variety of different Part D plans that can cover medications, many, dozens and dozens of these Part D plans. AARP has them, and many of the other major insurers have them. So pharmacists can be very helpful in assisting with the choice. It really depends on what your medications are, and how costly they are. That can you can review the plans and make a choice that is probably best for you. Again, having a caregiver help you with this, a family member, your pharmacist can be very helpful. So if you get confused with these plans, seek advice. And even if you choose a plan that doesn't seem to work out for you, you can remember you can always change your plan yearly during the open season period, which is October 15th to December 7th. There also are some website resources and app resources that can be very helpful. RxAssist.org is probably the most helpful resource center, which can give you information about patient assistance programs, which can be drug company related. They also can review and compare Medicare Part D programs, and also look at other issues related to access to medication. So RxAssist is really a good clearinghouse of information for potential for getting your medications a little bit less expensive. There also are a variety of different apps and websites, one of which is goodrx.com. They actually track prescription drug prices in a large number of pharmacies in the US and show you where the cheapest medication cost is in your area. And also they can provide some drug coupons for discounts on medications. So next slide, I'll tell you a little bit about what those sites look like. This is rx.org. Basically, it, again, is a good clearinghouse. It can connect you with resources. You can also search by drug name, and it give you detailed instructions on how to connect you with drug company patient assistance programs. Next slide. GoodRx, again, it's a free app, free service. In this website, you can actually enter your medication, click on the find the lowest prices, look at your area, and it can give you sort of a list of the pharmacies that have what the prices are for the quantities that you're looking for. Next slide. So GoodRx works by comparing prices. You can get free coupons that you can use to help pay for your medications, and your pharmacist can take you through that. So you basically give your prescription or just present yourself to the counter, ask the pharmacist, show them your coupon, and they'll do the rest. So GoodRx is a good, and there are other apps like this, but GoodRx is probably the most popular one. Okay, one question before we go into the summary. How can some pharmacists charge more for the same meds? It's almost like, why do grocery stores charge different prices for their produce? Okay, so there are all kinds of different factors involved with price setting. So it's not always related to the cost of the medications. It could be also related to how frequently you need to stock them. Very expensive medications obviously could be more expensive to stock. So there are a variety of different answers to that question. But you can see that there's a wide range of variants. So GoodRx can be helpful and give you and again, because a pharmacy could be cheaper in one medication, doesn't mean they could be cheaper in all their medications. So if cost is a major issue, then shopping around can be most helpful. What you lose from that is a consistent pharmacy that has all your medications on record. However, getting a relationship with a pharmacist is very helpful because it can help you navigate through this maze with a little bit more information. So in summary, medication use in the elderly is more complicated than with other age groups. Patients must be better informed and advocate for their best care. And these are some helpful web resources that you can use to get further information, both for yourself and as a caregiver for your patients. And this is my email address if you need to contact me directly, if you have any questions.
Awesome, thank you. I'm going to put all this in the chat so people can access it, but I'm just going to stop the share for right now. Feel free to put any more questions. We have a little bit more time left, so feel free to ask questions. I have one. Why do you think it's so complicated? Is it because elderly adults tend to have to take more medications, or do you think it's the lack of research that's done around how medications interact in the elderly? Like, do you think it's a combination of all that?
Combination. Yeah, the more meds you're on, the more potential you have for side effects. So if you're looking at 5 or more medications, half the population, elderly population, are on at least 5. That's prescription medication. So a lot of them take supplements, a lot of them take vitamins of different sorts. So a lot of that, the more that you take, the more potential that you have for side effects and also for interactions. Elderly patients also have changes in how they metabolize drugs and how they excrete drugs, how they absorb drugs. So those changes as you get older make you more likely generally to have more side effects and more issues. And the other issue is that if you have another underlying disorder that is the result of aging, like dementia or like dehydration, confusion, that sort of thing. So that makes you more likely to get side effects from drugs that have that as a side effect. So the more you have less in reserve as you get older, the more you are more sensitized to these specific side effects.
It looks like we got another question in the Q&A.
Okay. So when using GoodRx, some pharmacies tend to steer customers to a 30-day refill. As such, customer must insist on a 90-day refill if the RX so indicate. Be reminded that the copay is the same for 30 days and 90 days. Generally speaking, 90-day refills are better if you are on a medication that is a maintenance medication. Now, you don't want to get a 90-day fill for a drug that you first get because you don't know that you're going to be on that drug. So the worst thing that can happen is you take it for several days or a week, and then you have to get switched to something else. So 90-day fill just gives you extra meds that you're not going to use. And that's a waste, as well as it tends to accumulate. If you don't throw it out, you get, it increases the number of bottles that you have hanging around. So it's confusing if you decide to take the medicine, you don't remember whether you took that medicine or not, whether you're still taking it or not. So there's a lot of difference there. So on a first fill, you want to do 30 days. If you're going to be on a maintenance dose of medication, you really want to then go, if it's going to be a forever thing, the dose is going to be pretty stable, then going to 90 days makes more sense. The other thing you can do that's a cost saving is, and again, from personal experience, is that I'm on an eye drop for glaucoma, very small eye drop that I've added to my other regimen. And it was $150 for a small bottle. And that's with my copay. So if I paid out of pocket, it was something like $500. But it was $150 for per vial in my local drugstore. What I looked at was if I got a larger supply from my mail order company, that's my Blue Cross Blue Shield mail order company, actually could get 3 bottles for less than I paid for 1 bottle. So, and here I am, a pharmacist that's supposed to know about this stuff, and it took me like 3 months to figure that out, right? So it's always important to kind of, if you're looking for a cheaper, longer, and this is something I'm going to be on for the rest of my life. So looking for a longer duration of supply at a cheaper price, don't forget your mail order potential, which generally gives you a 90-day supply as a general rule.
I was going to ask about the mail order as well, so I'm glad that you brought that up.
So how
we do have another question. Yeah.
How should medicines be properly disposed? Well, it really depends on medication. One of the things that you can do is you don't want to flush it down the toilet. That's probably the worst thing, because it does go back in the septic systems, in the sewer systems. It does go back into wastewater, which can be an issue. So what you want to do is basically, best way to do that is to bag it in sort of like a unsavory combination, like coffee grounds. So take coffee grounds, put it in the bag, stick your pills in there, wrap it up, and throw it in the garbage. That's the best way to do that.
I think also I've noticed a lot of pharmacies have drop boxes as
Yes.
well. Is that also
Yes.
an option?
Another thing, you can drop it in the drop box. A lot of police stations have, for controlled substances, you can actually, if you have extra narcotics or other controlled substances, you can bring it to your local police station or fire station, and they can get rid of it.
Kind of along the same lines, how would you recommend people store their medication?
So storing the medication is, the worst thing you can do is put it in the bathroom cabinet, because if there's a shower, the steam can actually cause issues with degradation of some medications. So storage in a cool, dry place is probably the best. Out of real extreme heat. Try to keep it in the original bottles so that you don't confuse them. I know some people do reminders, like weekly reminders. That can be helpful for helping to remember to take doses. But also the problem is if you confuse meds when you put them in the reminder, you can have an issue, because and then a lot of times with the reminders containers are like morning and evening. Sometimes people will take the evening dose in the morning because they're opening up the wrong container. I've actually done that. So so it's easy to do. So what I try to do is if you have someone that's relatively cognizant, what I try to do is actually have my medication separated into morning and evening. Usually you can try to divide it into 2 different doses, morning and evening dose. Then I actually have them in 2 separate boxes. So I actually take out my evening dose, take each of them out of the bottle into a little cup. Then I'm actually not draining the bottle of the medication. I know how much exactly I have left. And as I'm putting them into the cup, I'm actually thinking about what this medication is, what it's for, what I'm using it for. So it actually is a reinforcement of understanding that I'm taking this medication rather than just taking a bunch of pills in your hand and swallowing it from a cup. So when I'm putting it in the cup, I'm actually thinking about what the medication is for. So I'm dividing the morning, the evening doses, and I'm doing that. But that's my own idiosyncratic way of doing that.
Also, real quick, someone did mention that if you are going to drop your medicine off at a drop box, to
Yep.
just remove your personal information from the medicine bottle. I think that's a
Yes.
great reminder.
Yes. So what you want to do is basically tear the your name, the name of the medicine too as well. So tear the label off. Sometimes it's more difficult to do, but that's the best way to do that, so you don't have your information out there. Also, if you get drug information from the pharmacy about side effects, this is your medication that you're on, try to shred that or get rid of that without having it intact.
Great, and I think this will probably be our last one unless anyone else has any more questions. Do you mind just repeating what you said about mail order versus the local pharmacy? So how you figured out that which one worked for you? And
yeah, so it really depends. If your local pharmacy many times can give you a 90-day supply. If your physician requests it or you request it from the pharmacist, it can give you a 90-day supply, which generally is cheaper if you pay for it by itself, but depending on the copay, it can be cheaper. But you can also check with your mail order supply, and you can actually call up your mail order company, and usually you can get a price for your 90-day supply. And then you can compare it to the 90-day supply that you can get to your local pharmacy, and that can give you an idea which way to go.
And is your mail order company usually dependent on your insurance? So if you're not sure who they are, you would call your insurance to determine that, or is it based on your pharmacy?
It's usually based on your insurance. So if you have a certain insurance, you might be directed towards, like, Caremark is a common one. So or they could be another other companies, but it's really determined. You can't just go to any other mail order. You have to go to the specific mail order that's included in your insurance. The disadvantage of that is that you have to do that with a pharmacy. You can go to any pharmacy that accepts your insurance, and they'll honor it. So there's a little bit of and you don't have the personalized, obviously, service that you do in the pharmacy with a mail order. But again, with mail order, you really want to do this for maintenance medications that you're going to be on for a while. You know how to take it. You're on the same dose for a while. You don't have the issue where you have a lot of potential need for consultation.
All right, amazing. If anybody has any last questions, feel free to put them in. I did kind of inundate the chat with all the links. I included Dr. Carvalho's email address if you have any questions. I also included the RX Assist and the GoodRx website and all of the different resources that he also mentioned in his slides. Yeah, this was very helpful. Thank you so much for taking your time to chat with us. I'm going to go remove all of my meds from my bathroom cabinet because that's where they are. So good to know that that's not where they belong. But yeah, I think all the questions are answered. If we missed, I don't think we missed any. Yeah, anybody has any questions, always feel free. You can reach out to Dr. Carvalho, or like he said, gab with your pharmacist. I love that. Gab with your pharmacist, gab with your medical care provider. And if you have any questions, always make sure you bring those to your doctor. Never worry about asking questions. I think that's the important thing. You have to advocate for yourself. So yeah, so I think Dr. Carvalho, you said you'd share these slides with us after the fact.
Yes.
Did I get that? Okay, so then we can send an email out with the slides with all this information to everyone who has joined us today. So you should get that at some point. We'll sort that out on our end. But yeah, thank you so much, everybody. I will be here tomorrow for the elder abuse webinar if you want to join that. And in the meantime, have a great rest of your day. I hope everyone stays warm and dry. And thank you again, Dr. Carvalho, for your time. We appreciate it.
Thank you. My pleasure.
Thank you, everyone. Bye.